Hi, my name is Tamara. I work for a private therapy clinic. I'm a child clinical psychologist, and my main role is to work with families, parents, and children. As parents, we've all heard about the famous timeout. We have all probably used timeout at some point, and we have all probably found out that at some point it's quite difficult, it's quite draining, and it's quite challenging. And most of the time, if indeed it does help to regulate a child's emotion, it doesn't really provide a safe space for you and your child to reconnect. Nowadays, we've come with a new technique, something that we have worked with in the clinic with a lot of clients, and something that most research points that it's a more healthy and empathetic way of connecting with your child. And that's what we call the Timein. So whereas when we are doing the timeout technique, we normally point to a behavior that we are noticing that our child is doing and that we are not happy about, and we take the child and we remove this child completely from the situation. We might even sometimes remove them from the space that they are interacting at. So we might send them to their room, or if they are in a school, we might send them to another different room. Timein is a complete different setting. What we want to do with Timein is you take your child, you go with your child to a safe place, and you remain with your child. So the main thing to keep in mind here is we're not sending this child away. We're not sending this child with his emotions, with his thoughts, with his worries away and leaving them by themselves with that monster in their head. What we're doing here is we're remaining with our child. We're remaining with their emotions, with their thoughts, with their worries. Basically, that's what we have to do, just remain. Timein is not about questioning your child, it's not about even touching your child, it's about being with your child at that point in time. What are the benefits of Timein versus timeout? When you start using Timein, probably you'll find that it's a little bit more difficult. If your child is having a huge tantrum and you want to really very badly be there with them, it might be very difficult for you to notice that your child is going through a lot of emotional distress. So going for the timeout totally seems like the best idea. I don't want to see my child in distress. I don't know how to deal with my child becoming distressed. So let me just send my child away. Again, it's going to be challenging, but long-term, Timein is the way to go. When you have Timein, sitting with your child, just sitting with them, looking at them in the eye, will overall reduce the amount of time it takes for your child to calm down from that tantrum, to calm down from that anger. And it will allow you to, at that point, establish what we call a more verbal, assertive communication with your child. At the end of the day, what we want is to try to understand what was my child actually thinking that led him to behave in this way. But if we are actually saying, here, you go with your tantrum somewhere else, we're saying to the child, I don't really care about what you were thinking. I don't really care about what you were feeling at that point. I just want you to go somewhere else. And by dismissing our child's thoughts and emotions, we're basically dismissing our child. And that can create a huge loss and a huge hurt to their self-confidence. And as parents, what we want to do is to try to create a healthy, strong personality in our children. And the best way to do that is by validating what they're thinking, what they're feeling. And this doesn't mean that we're saying that what they're doing is the best thing. They might be hurting their little brother, they might be throwing things at someone in school. We're not validating the behavior, we're validating their thought and their emotion at a certain point in time. And the only way to validate that is by showing them that we want them to be with us, that we want to keep them safe, and that there are other ways of working what they were thinking and what they were doing that are healthier and that will get them to actually connect at a different level with their peers and with other family members. So now that we know a little bit more about the difference between time in and time out, you might be wondering, where do I start? How much of time in do I need? How long will it take my child to settle down? There is no exact answer. I think it depends on the situation that you're facing. It depends on the emotional capacity that you as a parent have and that your child has. What we do know is that by offering a time in versus a time out, you're offering a safe place for your child to grow and explore emotions, and for them to actually communicate verbally at a very young age what is it that they were thinking at a certain point in time. Whereas the timeout will normally be a way of avoiding our communication taking place in the first place. What you're doing with a time in is inviting them to have that conversation with you when they are ready. So now that we know the difference about time in and time out, and if you're still wondering, how do I start this process? Is it the right technique to use with my child? If you want to further discuss a little bit about this technique, please don't hesitate to contact us at Private Therapy Clinic and schedule your free 15-minute phone conversation.